Here you are in a primary care clinic, and a patient asks, "Can I get a copy of my own health record?" What do you do? Under most privacy legislation, including Alberta's Health Information Act, a patient has the right to access their own records about themselves. The information that a patient provides to a healthcare provider when they come to the clinic belongs to the patient. The healthcare provider is responsible to maintain the information on paper or in a computer and owns the documents. Healthcare providers have a duty to assist the patient when the patient wants to access their own information or requests that it be disclosed. Healthcare providers will ask the patient questions about what information they want to access and to whom the patient authorizes that information be sent. They want to make sure that they are sending the correct information to the correct person. So the patient may ask for the information to be sent somewhere else, and the healthcare provider or the receptionist or the clinic manager will ask questions of that patient. Of course he can have access to your information. Can you help me understand what information do you specifically want to see? Do you have a particular question or a concern? We want to be able to understand the patient's request so that we can identify the reports which are going to be the most helpful to the patient or to the new healthcare provider. Common requests for patient records includes patients accessing their own information for their own personal use, or requesting their records to be transferred to another healthcare provider for continuing care and treatment. If the patient requests a copy of their own health record, the patient usually completes some paperwork. There's a consent form to complete, and then the office retrieves, reviews, and processes the records. Sometimes there is a charge for the time and effort required to prepare the patient's information, or the healthcare provider may choose to waive that fee. If a patient asks a physician to transfer his or her patient records to a new doctor, the fee guidelines established by Alberta Medical Association may apply. In Alberta, a physician may not charge another healthcare provider for the exchange of limited patient information, such as a copy of a discharge summary. So if there's no need for additional information, then the default position should be to get a patient summary report generated from most electronic medical records. This is certainly the fastest, most efficient, and cost-effective win-win solution for all parties. So when a patient asks to get their file transferred from one care provider to another, ask the patient some additional questions about what exactly they want to have access to. The default position is the patient summary. If they need additional information, now's the time to ask for it. A patient has the right to know how their health information is being collected, how it's being used and disclosed. A patient has the right to access their own health information. A healthcare practice that demonstrates attention to detail, courtesy to the patient, and respect for confidentiality will also have good business practices and excellent customer service. As a practice manager, clinic manager, healthcare provider, or an employee, it is your job to make sure that you know how to respond to the access request, process the request, and provide good customer service. See our series of articles on the key steps in patient access to health records. This is Jean Eaton, the Practice Management Mentor with Information Managers. Stay tuned.